Hello, welcome to ANA community. In this particular video, we are going to discuss the structured case history format. This particular structured case history format is discussed in the practical record book of Roga Nidana subject. The term structured case sheet, it is the nothing but the document of the patient's presenting complaint, a step by step information that has to be recorded in terms of the patient's individual details, in terms of the patient's presenting complaints, in terms of the history related to patients presenting complaints, etc. So that are going to be documented in the step-by-step pattern. So this is considered to be very, very essential whenever if you are making the diagnosis of the disease as such. When you think about the structured case sheet, so that actually starts with writing the name. When you think about this particular name, so documenting the name is having the very, very major clinical significance. The first and foremost thing, the patient will be getting the confidence over the clinician that if you are calling him by name, he may say that, oh, the doctor is really remembering me. So I can give the information which is very pertaining to me, my concern that can be shared with the clinician very easily. So that particular confidence will be developed in the patient as such. The second main thing, so that is avoiding the confusion between the clients visiting the hospital. Suppose there are possibilities wherein a person having the same name may enter into the hospital on the same time on the same day. So in that particular situation, to avoid the confusion, specifically when the laboratory investigations are being planned, in that particular situation, there may be a possibility of chances of a mismatch of these lab reports may happen. To avoid this particular confusion, so naming is very, very essential. And certain thing, for example, medical legal cases documentation. Suppose in case of the road traffic accident, or in case of the rape, etc., or in case of suicidal tendencies, etc. So there may be the documentation purposes, the name of the individual visiting the hospital is very, very essential. Later, we can able to identify the person's locality, or otherwise we can able to look into the cultural patterns that may be observed in that particular locality. There may be, we can able to identify the possible diet patterns that can be observed in an individual in that particular locality can be identified. Certain types of the regimen patterns that can be very well noticed. For example, if the person is having the surname as Nair, in the sense we can say that the person may be belonging to the state of Kerala. Or whenever if you are looking into the Reddy as a surname as such, we can able to see that particular population may be present in the Andhra Pradesh. And the surname with Gowda, there may be a possibility of the such type of surnames may be observed in Karnataka. Mehetre, that may be seen in Maharashtra. Dubey, as such, that can be observed in Hindi belt states. So like that, we can able to identify the possible person's locality. Based on that, we can able to identify the possible cultures, maybe or possible diet patterns can be seen, or possible regimen patterns can be assumed, and we can able to make the diagnosis even much more accurately. For that particular reason, the naming of the individual is necessary. Whenever if you think about the age as such, so there are certain diseases, they are very common in certain age groups. As far as fundamentals of Ayurveda is concerned, so diseases are considered to be mainly happening because of the dosha vitiation. There may be a possibility of kapha dosha vitiation, pitta dosha vitiation, or vata dosha vitiation. There is a relation between the age group and the dosha dominance. For example, it is being mentioned in Charaka Samhita, 0 to 30 years will be having the Kapha dosha dominance, wherein 30 to 60 they may be having the Pitta dosha dominance, and 60 onwards till that there may be a possibility of a Vata dosha dominance. Further, in cases of the Kapha dosha dominance, 0 to 16 that is considered to be Aparipakva Dhatu Avastha, wherein the proper development of the body tissues will not be there. Immature development of the bodily tissues are observed in those situations, wherein 16 to 30, which is considered to be the progressively developing, the body tissues are being observed. That is what we can see, Aparipakva Dhatu Avastha and Vivardhamana Dhatu Avastha. So that is the further subclassification in terms of the Kapha dosha dominant age group. So like that. So based on that particular age group passage, we can able to possibly identify what might be the possible dosha afflicted in the individual can be predicted. Suppose if the person is having the 25 years old, in the sense, naturally there may be a possibility of kapha dosha vitiation. 32 years old male, there may be a possibility of pitta dosha vitiation. So like that, the age of the individual will be helpful in making the clinical diagnosis of the possible disease affliction as such. When you think about the gender as such, so that means, so the nature of the work that may be done by the different genders as such. For example, the in this particular image, usually the cooking as such, of course, may be usually done by the women, or the heavy vehicle driving are usually taken up by male individuals. So like that, the specifically we can able to think about the possible gender as such, so which may be helpful in making the clinical diagnosis as such. For example, if the lady presented with sneezing as such in this particular image, probably that may be attributable to some kind of the allergy related to some kind of food items. In that way, that may be helpful as such. Whereas the another image where the person may be suffering from the constipation as such, in this particular situation, the male, so that is long heavy vehicle driving may be one of the reason in this particular situation, wherein the person may be possibly holding the urge of defecation for longer amount of time. That may be the one of the possible reason that can be pointed out here. So in this way, we can able to make the diagnosis of the diseases based upon the gender as such. Regarding the occupation, so we need to know about the what kind of the occupation a person is doing. Everyone is having the 24 hours. Among that, so nearly 7 to 8 hours are needed for sleep. And regarding the rest of the 16 hours, what the individual is doing, the most of the activity, whether they are doing the activity of, for example, agriculture, or otherwise they are going to do the activity of some clerical work, or they are going to do the activity of what do you say, the teaching as such. In that way, so occupation of an individual that may be helpful in making the clinical diagnosis as such. For example, if the person is having the occupation of cooking and he is most commonly having the presenting complaint of sneezing, etc., then we may say that this particular presenting complaint of sneezing may be attributable to some kind of the allergy that may be attributable to that particular occupation as such. Further, regarding the duration of the work as such, this may be attributable to either person is doing 6 hours work, or 8 hours work, or 12 hours of work, or 16 hours of work as such. So depending upon the duration of work, we can able to identify whether it is physically stress inducing or mentally stress inducing as such. And nature of sleep, what kind of the sleep the person is having. So the persons who are having the night shift kind of the activities, most of the occasions they may be having the disturbed sleep during the night time as such. Or otherwise, the persons who are having the, what do you say, that the having the long vehicle driving, specifically at night time, they may be having the total disturbed sleep most of the occasions as such. For example, in this particular image, wherein it said the doctor, a professionist by profession. Suppose if she is a gynecologist, then there may be a possibility of the on-call delivery anytime, maybe round the clock. The doctor has to be ready. If she is working in her own private nursing home, then this particular chance of risk of having the severe sleep disturbances in this particular occasion. The second image that is showing the person may be a policeman. Policeman in the sense we are knowing what kind of the mental stress these people they may have. So because of that, the nature of the stress as such, they are having the that kind of, what do you say, that the person may develop the hypertension or the diabetes mellitus, etc., etc. So this is what is considered to be the occupation, and the presenting complaints can be related as such. Regarding the residence, what kind of the residence a person is residing, whether is it the small hut as such, or whether is it considered to be the big mansion as such, or otherwise whether the person is living in a hot atmosphere, for example in case of the desert as such, or the area of the western India, for example, Rajasthan, etc., there may be a possible hot climate, or our national capital, Delhi, there may be a possibility of hot climate, specifically in the month of May, etc. So, in this way, or otherwise, whether they are residing in a cold atmosphere, etc., and this may be helpful in making the diagnosis as such. Then, nature of the diet in the surroundings. What kind of the diet they are doing? For example, in the belt of the Uttar Pradesh as such, there may be the most of the staple diet they are going to consume is samosa. So that means if the what kind of the uh, chutney they are being using, whether they are using the sweet chutney or whether they are using the green chutney, which is prepared by green chili, etc., they are going to use. That may have an impact on the body later as such. That means if the person is having the habit of samosa consumption, we may suspect there may be a possibility of pitta dosha vishesha in due course of time. Or otherwise, we may say that there may be a possibility of rakta dosha affliction in due course of time. In this way, so nature of diet we can able to plan, we can able to think about by looking into the one person's residence as such. And regarding the presence of trees, if the left image that is showing presence of trees, in the sense there may be a possibility of the cold environment. So, or otherwise there may be a possibility of the breeding place for mosquitoes as such. That means there may be a possibility of mosquito-borne infections that may be possible in that particular locality. For example, if the person is visiting to you with the history of a fever, if if that is related to the hill station as such, then we may suspect the most common cause could be mosquito-borne infection may be possible. In this way, the residence of an individual may be helpful in making the clinical diagnosis. Regarding the Vyadhi Vinishchaya, that means the diagnosis has to be mentioned at the beginning. For example, if the person is coming to you with a history of the presenting complaint of this, so here the person or individual is having the swelling on the right knee joint. So that is based on that, we may suspect what might be the possible srotas afflicted. There may be a possibility of Ashthivaha srotas involvement as well as Majjavaha srotas involvement. So dosha involvement may be, as the person is having the swelling, there may be a possibility of kapha dosha dominance. If it is associated with pain, there may be a possibility of Vata dosha vitiation. In this way, we can able to predict the dosha involved. Whereas dosha involved could be asthi and majja dhatu affliction can be predicted here. Roga marga afflicted. As such, it is the joint that is being afflicted. Definitely, marma asti sandhayaha. In the sense, that is, a madhyama roga marga involved may be predicted. Part of the body involved in the disease process. As such, it is sandhi, as such, that can be afflicted, that can be considered here. Janu sandhi affliction can be predicted. As far as satya satyata of an illness that can be predicted is asthi and majja vahasrotas affliction. If it is having the vata and kapha dosha dominance, asthi and majja dhatu involved, madhyama roga marga is afflicted. In a sense, the probability it is more favoring towards the Krishna Sadhya or Yapya or Pratyakshaya Vikara. In that way, the Vyadhi Vinishchaya of the particular presenting complaint can be predicted. As far as the next step of the structured case sheet, that is presenting complaints. So we have to note the presenting complaints. The person may be having either one presenting complaint or two presenting complaint or three presenting complaint or more. Depending upon that, we have to document what are the presenting complaints the person may be presented with. Here, one particular thing that has to be noted is these presenting complaints should be mentioned in patient's own words. For example, if the person may say, I am having this sneezing, or I am having the heaviness of the head, or I am having the tastelessness, or I am having the loss of appetite, or I am having the constipation, or I am having the diarrhea, etc. In that way, presenting complaint should be mentioned. So that should be mentioned in his own words. And the main thing that one has to note is if the person is saying, I am having the thyroid problem, that is not the presenting complaint. I am having the diabetes mellitus. That is not the presenting complaint. I am having the hypertension. That is not the presenting complaint. I am having the kidney disease. That is not the presenting complaint. We are supposed to know. Suppose if the person is saying kidney disease, what kind of the kidney problem do you have? Do you have the pain? Or do you have the burning micturition? Or do you having the increased micturition? Or do you have the retention of urine? Etc. That particular that should be the presenting complaint that should be recorded in the or documented in the case sheet as such. Suppose if the person is saying in this particular image, that is the sneezing that is being, if that is being present, the second presenting complaint probably it could be cough. Third presenting complaint could be sputum. So that should be mentioned in the same chronological order: sneezing, cough, and sputum. In that particular situation, we can able to predict the possible source of entry of pathogen could be nose. Dosha vitiation, in that particular situation, we can able to identify Vata initially, followed by Kapha dosha vitiation. Dosha afflicted in this particular occasion can be predicted, could be Rasadhatu affliction can be predicted. Or if the person is having the what do you say, that the bleeding through the nose as such, even we can able to predict the possible Rakta Dhatu affliction. In this way, the presenting complaints will be helpful in identifying the or channelizing the actual pathological processes that's happening inside the body. As far as history of present illness is concerned, the following parts are should be documented in the history of present illness: onset and duration, then location, radiation and character. So that should be documented if the person is having the pain. Then if the person is not having the pain, then this location, radiation and character of the discomfort are not recorded. Whereas the other aspects, severity, course of the symptom, aggravating and relieving factors, etc., plus negative history, that should be documented in all the presenting complaints as such. Why so this documentation of these are necessary? For example, whenever if you are documenting the onset and duration, we can able to note about the impact of Nidana as such. For example, the person is going to consume the gobi Manchuria. So in the sense, there may be a possibility of the person may be having the bloating sensation of the abdomen. The person may be having the sore eructation. The person may be having the what is retrosternal burning sensation, etc. So that means here the impact of the Nidana that can be predicted, probably if the person is having this kind of presenting complaint, we may suspect there may be a possibility of a Katu Katurasa, Ushna, Tikshna Viryaja substances as such we can able to consider regarding the impact of Nidana. Location, radiation and character. So by this we can able to identify the possible part of or organ of the body afflicted. For example, if the person is having pain in the epigastric region, radiating towards the retrosternal area. So here the possible part of the body afflicted could be stomach. If the person is having the pain in the epigastric region, radiating towards the left part of the chest as such to the back, the possible organ afflicted could be pancreas. If the person is having the pain that is radiating from right loin to right groin, we may suspect the possible organ afflicted could be ureter. If the person is having the pain in the retrosternal region, radiating towards the left shoulder, the possible organ afflicted could be heart. If the person is having the pain in the frontal area, then we may suspect the possible organ afflicted could be frontal sinus. So like that, we can able to identify the possible part of the body or organ afflicted by looking into the location or character of the pain or radiation of the pain as such. So when you think about the severity, we can able to grade it by looking into the quality of the life led by the patient that is being compromised. When the person is having the severe pain as such, most of his routine activities will be at reduced pace as such. So when you think about the course of the symptom, if the person is having the improving course of the symptom, in the sense initially the person is having the severe pain, now he is having the reduced pain as such, so that is indicative of the exposure for Nidana that is going to get reduced. Or when you think about the presenting the course of the symptom is worsening, in the sense the person is having the initially mild symptom, now he is having the severe symptom, in the sense that is indicative of the Nidana exposure is still continuing or that is increased as such. Suppose if the person is having the severe pain at the beginning, now also he is having the severe pain, in the sense the person is having the exposure, continuous exposure of Nidana or etiological factor, that too in the same quantity or same pace that Nidana exposure can be predicted if there is persistent course as such. Suppose aggravating relieving factors. So this is helpful in knowing about the possible dosha responsible for the manifestation of the disease. For example, in this particular occasion, if the person is having the aggravating pain by consumption of this gobi Manchurian, etc., we may suspect there may be a possibility of a pitta dosha vitiation or vata dosha vitiation. Suppose if the person is having the worsening of the symptom or aggravation of the symptom by consumption of the banana, etc., we may suspect there may be a possibility of kapha dosha vitiation. In this way, aggravation and relieving factors, that is the consumption of banana, if it is reducing the discomfort as such, so that is indicative of the pitta dosha vitiation. For this, the text says, Tatradyam traistiktadeha kafam kashayatikta madhuraha pittam anyatu kurvate. So like that, so this will be helpful. When you think about the negative history, this is helpful in ruling out the dosha dushya affliction. Possible srotas affliction that can be ruled out. Possible status of the Agni, whether it is Mandagni, Tikshnagni, etc., that can be identified. Rogamarga affliction that can be predicted. Whether the person is having the Madhyama Rogamarga affliction, or whether the person is having the Bhakya Rogamarga affliction, or whether the person is having the Abhyantara Rogamarga affliction, we can able to predict it. Part of the body afflicted so far, that's what we have discussed earlier, that can also be predicted. Regarding Sadhya Sadhata of an illness, can be predicted. This how history of present illness will be helpful in making the diagnosis of the disease as such. When you think about the interpretation of a complaint as well as history of present illness, in this particular image, the lady is presented with sneezing. The possible dosha afflicted could be in that particular situation, that is Vata dosha vitiation. That too, Pranavata as well as Udanavata affliction can be predicted. And as far as the Dhatu affliction could be in this particular occasion, that is, there may be a possibility of Rasodhatu affliction can be predicted. As far as Sama or Nirama dosha avastha, we have to think about, is there any possibility of the disturbances in case of the appetite or any kind of the excess amount of the sputum production is there or not? If it is being present, we may suspect Sama Kapha affliction as such. Avilaha Tantulastyana Kantadeshe Vatishtate. So here the possible the organ affliction in this particular occasion may be the respiratory passage as such. As far as throat afflicted could be, Pranavaha throat affliction can be predicted. As far as system afflicted is in this particular occasion, here there may be a possibility of respiratory system affliction. So like that, any other observation that has to be mentioned in this particular record as such. In this way, interpretation of complaint based on the presenting complaint as well as history of present illness that are being recorded. As far as previous history is concerned. So we are noting about the medical illnesses as such, regarding what kind of dosha vitiated, regarding that what dushya may be afflicted, what are the possible srotas affliction can be predicted, what kind of the rogamarga affliction that can be seen, that has to be recorded based on the medical history as that can be predicted. Regarding the surgical illnesses, again, by looking into the surgical history, we may predict what might be the dosha afflicted, what might be the dushya afflicted, what might be the srotas afflicted, what might be the possible rogamarga affliction. For example, if the person is having the surgery of the hemorrhoidectomy, we may suspect the possible dosha affliction could be Vata dosha. Possible dosha afflicted could be Purisha Vahasrotas, that is Purisha as such. Possible Srotas afflicted could be Purisha Vahasrotas. Possible Rogamarga afflicted could be the Abhyantara Rogamarga, and to some extent, if it is anus is being afflicted as such, even Madhyama Rogamarga affliction can be predicted. Regarding the childhood illnesses, any kind of the childhood illnesses, if it is being present at the age of 0 to 16 years, we may suspect the aparipakva dhatu avastha as such in an individual. And if the person is having the presenting complaints in between 16 to 30, we may suspect vivardhamana dhatu avastha can be predicted as such. Regarding the psychiatric illnesses, which may helpful in predicting the possible rajodosha affliction or tamodosha affliction. Let us take the example. Suppose if the person is having the this kind of the skin ailment and he is having the presenting complaint of the diarrhea or adhisara for one day. In that particular situation, here this will be recorded in the previous history. So here it could be a medical illness as such. So here the possible dosha afflicted could be pitta, and possible dhatu afflicted could be the rasa rakta as such. Possible srotas afflicted could be rasa raktavaha srotas. Rasavaha srotas and raktavaha srotas affliction can be predicted. As far as roga marga affliction is concerned, it could be bahya roga marga affliction can be predicted. In this way, the previous history will be helpful in making the clinical diagnosis. As far as treatment history is concerned, the same patient is coming to you. As such, by this we can able to predict the possible treatment taken can be predicted. Suppose if the person is visiting to you by looking into the other possible Ayurveda hospital as such, what kind of the medications the person has taken, whether is it Arogyavardhini Rasa, so which is specifically indicated in case of the Kushta or the skin diseases as such. By that we may able to predict the Rakta affliction, Raktavaha Srotas affliction, or there may be a possibility of Rechaka effect, and we may predict the possible Raktavaha Srotas affliction or Svedava Srotas affliction can be predicted. If the person may be giving, the person may also give the history of consumption of either Kamadugarasa or Manjishtadi Kashaya or Khadirarishta, etc. History may be given by the patient, or there may be a possibility of either Vamana or Virechana history that can be obtained by the patient, or otherwise by the home remedies such as application of chandana on the face that can be given by the patient as such. So by that, what kind of the treatment the person has undergone, whether he has taken self medications or whether he has visited the different hospitals, etc., that can be predicted based on the treatment history as such. As far as the family history is concerned, whenever if you think about the family history, this has to be recorded on the pedigree chart. So regarding the different pedigree chart is being mentioned in this particular image on the left side as such. Extreme left below, there is an image wherein the possible girl is presented with sneezing. In that particular situation, we are going to think about whether the such kind of the presenting complaint is present in the whole family members or the patient himself herself, that has to be recorded. If that is being present in the whole family, at least 2 or 3 members in her family, probably that may suspect the possible the allergic environment in that particular home that can be predicted. So here we need to know about any kind of the what do you say, that the health related to grandparents, parents, siblings, or children or grandchildren, that has to be recorded. This will be helpful in predicting about the hereditary diseases as such. Or otherwise, if the person is having any kind of presenting complaint since birth, this may suspect the possibility of the congenital diseases as such. Then we need to know about the family member and his relation to the patient as such, whether it is father or mother or wife. In that, what kind of the medical conditions they are being having, whether they are having the diabetes mellitus or hypertension or bronchial asthma or some kind of the, what do you say, that the uh, any kind of the cancer as such, history of cancer is being present or not. So that has to be recorded there in that particular situation. So here the possibly here the presence of asthma, suppose if the person is a male, then the presence of asthma in the families as such, that may helpful in predicting the possible the allergens exposure in that particular home as such. In this way, the family history will be helpful in predicting the possible diagnosis of the disease as such. As far as personal history is concerned, Here we are going to note about the what kind of the ahara matra, whether he is having the more amount of the food or less amount of the food earlier, and what is his present day altered diet habits, that has to be known. Whether he is taking the little amount of the food or large amount of the food, that will be considered as such. So here the documentation as such. So for example, if the person is consuming aloo paratha, in that particular situation, naturally aloo paratha may be having lavana rasa, that may be having the tikshna guna, and that may increase the rajasika aspect. So that means aloo paratha consumption, so that may be helpful, or in that may be responsible for the increase of the abnormal rakta in the body. Thereby increase of abnormal pitta may be happening in the body as such. Or otherwise, if the person is taking aloo paratha along with dahi, in a sense, there may be a possibility of lavana rasa and tikshna guna increase, plus rajasika dosha increase, plus even tamasika dosha may also get increased. In this way, so because of the consumption of dadhi as such. For example, if the person is having the consumption of coffee almost 6 times a day, in the sense there may be a possibility of madhura rasa intake plus ushna virya substances intake, plus there may be a possibility of rajasika dosha dominance may be possible. In that way, there may be a possibility of rakta dhatu affliction. In this way, we have to note about the possible type of the ahara consumption based on what kind of the agni, whether the person is having the mandagni, tikshnagni, or samagni, or vishamagni, etc. We can able to predict regarding the nature of appearance of appetite. Based on that, we can able to predict. Koshtha, regarding the what kind of the koshtha the person is having. That means whether the person is able to pass the fecal matter easily, or whether the person is passing the fecal matter very with very difficulty. As such, what kind of the food substances? Sometimes even drinking simple amount of the one glass of water may lead to the passage of bowels as such. So like that, so we have to note about the possible koshtha we can able to analyze. Regarding the mala, what kind of the mala the person is passing? Whether the person is passing very hard fecal matter or very soft fecal matter, or unformed stools is being passed, or the properly formed stools are being passed, or whether the mala is sinking, or whether the person is floating in the water on the lavatory, that should be known. Regarding the mutra, what kind of the mutra the person is passing? Regarding the frequency, how much frequently the person is visiting the washroom, or what is the possible color of the urine is being passed, whether it is yellow or colorless, etc. What kind of the, whether is it being passed with the what do you say, that the delay in the initiation of maturation, or whether is there any terminal dribbling is being present, that will be recorded here. Nidra, what kind of the nidra is having, whether the person is having the sound sleep or disturbed sleep, or whether the person is having the snoring, or whether the person is having the any kind of the, what do you say, that the possibly the dreams appearance, etc. that will be known. Regarding the vyasana, what kind of the vyasana the person is having, whether the person is having the habit of or the consumption of the cigarette smoking or alcohol consumption, or whether the person is having the habit of the consuming tobacco chewing, etc., or metal leaf chewing, etc., that has to be recorded. Plus what kind of the work the person is going to do, whether is it extremely physically debilitating work or mentally straining work, etc., that should be recorded there. Regarding the history taking of a menstrual and obstetric history in case of the interaction with the female patients. So that should be recorded regarding the menstrual history as such. So that means whether the lady is having the regular or irregular menstruation. If that is regular, in the sense regarding the days of the flow, how many days the menstrual flow will be, whether is it 1 day or 5 days or 8 days or more, that should be recorded. Regarding the duration of menstrual cycle, in the sense if the lady is presented with the menstruation today, after how many days she may be having the next menstrual cycle. So that will be giving us the duration of menstrual cycle, whether is it 20 days cycle or 28 days cycle or 31 days cycle or more, that should be recorded. Regarding the nature of flow, so that means how many quantity regarding the that has to be recorded. So this can be predicted based on the number of pads that are being used by the lady, or the use of menstrual cup. Based on that, we can able to analyze regarding the nature of flow. If that is scanty flow, we may suspect there may be a possibility of a vata dosha vitiation in the body. Further, regarding the clots appearance, if the clots are being observed in the menstrual flow, so that may be indicative of the pitta dosha vitiation as such. Any other presenting complaints, for example, pain in the thighs, may be indicative of vata dosha dominance, or white discharge per vagina may be indicative of the kapha dosha dominance, or mood swings may be indicative of the vata dosha dominance as such, that can be predicted. When you think about the further interaction with relation to Raja Pravritti, so that is regarding the occurrence of timing of a menstruation. Whether the lady is presented with the appearance of menstruation at around 12 noon or 12 midnight, that may suspect the Pitta dosha dominance at that particular time period. Or if the lady is presented with 4 or 5 a.m. as appearance of menstruation, then we may suspect the Vata dosha dominance may be responsible for that particular appearance of menstruation. Or 6 or 7 a.m., if the lady is presented with the menstruation, then we may suspect there may be a possibility of a Kapha dosha dominance at that particular time period. So, like that, menstrual history will be helpful in in possibly identifying the pathological changes happening inside the body. Regarding the obstetric history, what kind of the uh, obstetric history the lady is having. So that is, for example, first delivery. If the lady is having cesarean section, that has to be known. If that is responsible any kind of the postpartum complications. So the regarding postpartum complications, if you simply ask that there may be a possibility of no possible complications, maybe the answer you may get by the ladies as such. In that particular situation, you are supposed to ask, is there any history of a postpartum hemorrhage, that is bleeding after delivery? Or is there any possibility of the, what you say, that the urinary tract infection, burning micturition was being present or not? Or whether did you have any kind of the pain in the breast? Because at that particular time period, the children or the infants are not in a position to suck the milk, that is the breast milk will not be sucked by the children. In that particular situation, the lady may be having the pain in the breast as such. Because of that, that there may be a possible clogged milk that may be seen, or there may be a possible uterine infections, that is there may be a possible pain in the lower abdomen, etc., the lady may be having. So, or otherwise, after delivery, there may be possibility of a painful coitus. The when the lady is going for the intercourse as such, the lady may be having a painful intercourse as such, or otherwise there may be a possibility of episiotomy pain or postpartum depression, etc. That may be are the different postpartum complications that can be seen. So this in history has to be elicited by the interviewer. So whenever if you think about this kind of the presenting complaints, then we may suspect the possibility of apana vata vikriti may be the initial event that can be observed in this particular occasion. Regarding the occupational history. What do you mean by occupational history? The occupational history will be helpful in noting about the relation with the presenting complaint and the occupation as such. For example, if the person is having the agriculture as his occupation, and if the person is having the cough as the presenting complaint, then we may suspect the possibility of they were to say that the dust exposure or the any kind of the plant exposure that may be responsible for the cough as such. Or if the person is having the cough on consumption of water, etc., then we may suspect there may be a possibility of entry of water in from the mouth into the respiratory passage, or otherwise there may be a possibility of entry of the water in the nose as such from the in the form of regurgitation that can be predicted. So like that, so the occupation, so that is may be helpful in detecting the possible cause of the disease, that thereby diagnosis of the disease may be easier. So regarding the different occupations we have to think about, and the what might be the possible surroundings, what may be the possible situations, and for their presenting complaints that has to be connected like this. For example, teaching profession, so or otherwise policemen, both are having the habit of standing for a longer amount of time. In that way, clerical work as such, both of this the people who are having this particular work, they are usually most of the occasion they will be sitting on the chair as such, or otherwise factory worker or Ayurveda medical preparation as such. In that way, so that is they are specifically factory workers, they may be having the exposure to heat as such, or otherwise Ayurvedic medical preparation, medicine preparation as such, they may be exposed to the different plants, thereby sneezing, etc. That may be possible. So in this way, the example here, for example, if the person is having agriculture and he is having the physical exertion from 10 a.m. to 3 p.m. as such, then we may suspect the possible Sharirika dosha affliction could be Vata dosha. In that way, we can able to predict based on the occupation as such and based on the social history. So that is, when you think about the social history, suppose if the person is having the coughing, we need to know about the what might be the living situation. Whether the person is in living alone, then the possibility could be for coughing could be the allergy that may be possible in his home as such, or if he is living in community, in the sense we need to know about the what might be the status of the people living around him or her may be helpful. Regarding the educational background as such, in case of coughing as such, for example, if the person is having the continuously drinking about the uh, curds, thereby the coughing may be possible. As per Ayurveda fundamentals, it is being mentioned that curds intake in excess may lead to kapha dosha vitiation as such. So like that, the what to say that the social history will be helpful in documenting the what to say that the case history as such. Regarding the environmental history, we need to know about what kind of the environment the person is born, what kind of the environment the person is grown, what kind of the environment the person is getting the disease, whether is it Jangala Desha or Anupadesha or Sadharana Desha, that has to be recorded. In the sense, for example, in case of the Jata Desha, that means up to how many years the person is living in that particular Jangala Desha or Anupadesha or Sadharana Desha, as such that has to be recorded. Or otherwise, if the person is having the disease manifestation, for how many days the person is living in that particular locality, that has to be recorded. For example, if the person is living in this particular area, in the sense this is mainly indicative of the kapha dosha vitiation. So depending upon that, most of the people living in that particular locality, they are most commonly they are taking either tea or coffee, etc. That is, or otherwise hot substances as such. Whereas people who are residing in this particular locality, wherein the more amount of the sunlight is being present, then most of the occasion they are going to consume ice cold water or the cold juices, etc., rather than the tea, coffee, etc. In this way, the environmental history may be helpful in predicting the possible the diet pattern, possible lifestyle, etc. that can be predicted, which may be helpful in predicting the possible disease manifestation as such. Regarding the environmental history, what kind of the nature of environment in a particular locality that has to be recorded, and based on that, what might be the nature of food habits that can be observed, nature of lifestyle in that particular locality that has to be predicted by looking into the person who is living in a particular locality. For example, here the person is, if he is residing in a city, in that particular situation, most of the occasions we may look into the what might be the possible the mental stress among these people. Maybe we can able to see most of the occasions they are having the Rajadosha dominance. So here when you think about this particular locality, so the probably if the people may be having the symptoms mainly related to allergens exposure as such. Whereas in this particular city life, most of the people are having the habit of what do you say that the affliction of what do you say the smoke related diseases as such. To sum up, when you think about the overall analysis of a structured case sheet, we can able to learn that history taking is an art. Sometimes we can say that it's a science too. In the sense, if you are taking this in a proper way, then diagnosis of the disease is not at all difficult. It is very easy. Each and every part of the section of the history taking will be giving a best clue in making the diagnosis in terms of dosha vitiation, in terms of the dhatu vitiation, in terms of the mala vitiation, in terms of the srotas affliction, in terms of the srotodushti affliction, in terms of the Agni involvement, in terms of the Ama presence in the body, or in terms of the Roga Marga affliction, in terms of the Sadhya Sadhyata affliction, Sadhya Sadhyata assessment. So, like that. So, each part of the section of history taking will be helpful in making the diagnosis of the diseases as such. And structured case sheet, in terms of the case history taking, they are having the following headings: preliminary data, wherein name, age, gender, residence, occupation, and Vyadhi Vinishchaya will be recorded there, and chief complaints, which are recorded in patient's own words and which are recorded in the chronological order, wherein the history of present illness will be recording the presenting complaints and their details, that too in the chronological order, wherein previous history giving us the details of the health status previous to the presenting complaints will be recorded. Treatment history will be giving us the type of treatment received by an individual. So far, that will be recorded there. Family history, that will be recording the health status of the parents, grandparents, siblings, children, grandchildren, etc., plus the spouse, etc., that will be recorded in this particular family history. To know about the occurrence of any kind of the hereditary diseases, any kind of the congenital diseases, any kind of the what do you say that the The irregular lifestyle of a particular community will be recorded in this particular family history. In terms of the personal history, so that is noting about the individual lifestyle in terms of the either diet, in terms of the either sleep, bowel movements, or any kind of the habits, etc., that will be recorded. In case of the females, we are going to record the menstrual and obstetric history, wherein most of the occasions we are going to predict the possibility of a Apanavata involvement in that particular situation. Occupational history will be concentrating upon the nature of occupation a person is having, that will be recorded. Social and economical history are actually recording, or environmental history are actually saying about the lifestyle of the individuals. These are the sequence of the case taking. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.